Preparing.
It's preparing. We're good. I think we're live. Okay. Hello, everybody. It's been a couple of weeks since we've gone live. I hope everybody's had a great couple of weeks. And today we are here with our panelists to talk about birth control. And this week I'm going to ask our panelists to actually introduce themselves, and feel free to state your pronouns if you would like. I'll go first. I'm April Borkman. I am the Director of Operations for the Empower program, and I use she, her pronouns. Tanel, would you like to go next?
Sure. I'm Tanel Jones. I am a licensed marriage and family therapist, licensed addiction counselor, and I'm the health educator for the Empower program.
Hey everyone, my name is Brittany Green and I'm the follow-up victim advocate for people against rape, and my pronouns are she, her, and hers.
Hi, my name is Bradley. I'm the prevention education coordinator. My pronouns are they, them, she, hers.
Good afternoon, everyone. My name is Cora Webb. My pronouns are they and she, and I'm the program director for We Are Family of Charleston. Thank you.
Awesome. And this is Cora's first panel with us, so we're super excited to have her here. Thank you so much for being here. All right, so as I mentioned, we are going to talk about contraception, aka birth control today. And we are going to start with a little bit of a review. We've been posting lots of stuff on our social media for the last couple of weeks, just kind of giving little snippets about different types of contraception and birth control. But I'm going to let Brittany kind of start us off telling us what is birth control. And then why don't you start there, and then we'll follow up with some more specific information.
Absolutely. So birth control is any method using medicine or device to prevent pregnancy. This can be really important, when we discuss at the beginning of our series, the importance of setting goals and planning for what you want your future to look like. And so when you're looking at birth control and what methods you want to use, what medications, it's really important that you have in mind what you want your future to look like when it comes to your reproductive health.
So birth control comes in different types. And you often hear people talk about barrier methods and hormonal methods. Can you kind of describe what the difference between those two is?
Absolutely. So barrier methods, they are methods that you use each time you have sex, and they basically create a barrier between you and your partner that would prevent sperm and egg from meeting. An example of these would be condoms, diaphragms, sponges, cervical caps, and also spermicide. Hormonal birth control methods are broken down into two different types. We have short-acting methods that are typically medications that are taken every day, shots that might be taken every 3 months or every month. So this would be pills, the patch, the shot, or a vaginal ring. And then we have long-term acting normal hormonal implants, which would also include intrauterine devices, IUDs. And these are devices that are implanted into your uterus to prevent pregnancy from 3 to 10 years, depending on how long you are wanting it to be.
Cool. So just to recap, we're talking about barrier methods, or pretty much like internal, external condoms, spermicides, cervical caps, diaphragms. And I think we're going to get later into, Bradley's going to tell us a little bit of where you can get some of these things. And then the hormonal methods are, the pill, which you take every day, the patch, which is switched out once a week, the shot, which is once every 90 days. You have to go to the doctor for that. The ring, which is switched out every month. The implant, which can actually, just for those watching, you can actually get the implant and it's good for like 3 years at least. And then the IUD, which can be something like longer than 3 years, which actually is inserted into the uterus. So those are some of the hormonal methods. And if you want more information about those methods, we've been posting on our social media about them, but you can also go to Planned Parenthood. They have lots of really great videos and information. Also, nodrama.org. So NODRAMA.org. is a great website that is for South Carolina specific, that has lots of information about different types of birth control too. And it's very youth friendly, young person friendly. Okay, Bradley. So if a young person wants to go and find birth control, what should they do?
So we're going to talk about more of like the more common household birth control first. So condoms. Condoms can typically be purchased at any type of supermarket, convenience store, typically just drugstores, any place that mostly might be nearby. I do want to mention that dental dams can sometimes be available in places like convenience stores, but they're a little bit harder to find. Another type of backup birth control known as Plan B is also available in these places. It's a little bit more expensive, but that is also just a backup plan to prevent pregnancy. It's not necessarily known as a main form of birth control. So then when we start talking about types of birth control that involve seeing a doctor or getting a prescription, these are going to be methods like IUDs, implants, the shot, pill, patch, or ring. And to get these, you can talk with your local doctor if you see a specialist like a gynecologist, or you can also contact your local Planned Parenthood.
All right. And so what about young age, right? So did you talk about age of consent and that kind of like how old do you have to be? Are there rules about age in accessing birth control, like hormonal methods and things like that? Condoms even, do you have to be a certain age to buy them?
So to buy condoms, you do not have to be a certain age. They don't check an ID. When you go in, they can be typically a little more expensive, and you can also have access to free condoms. Some places just in our community are going to be just general clinics. Empower has an online option where you can fill out a form and get condoms that way. People Against Rape also has condoms. We Are Family, Planned Parenthood, Palmetto Community Care. These are many places, and just a few of the many, where you can access free condoms. When you're talking about hormonal birth control, there is an age of consent, which is 16. And once again, these are birth control methods such as the pill, the patch, the ring, shot, implant. And hormonal forms of birth control can be really useful if you're suffering from cramps or PMS. So the age of consent, once again, is 16, but there are places like DHEC where teens under the age of 16 can get birth control without parental permission.
Awesome. Yeah, we have a lot of resources here in Charleston, especially for free condoms. And we will post Empower after this is done. I'll repost on our Facebook and our Instagram and our Twitter the link to, we are partnered with Palmetto Community Care because of National HIV Testing Day, which is tomorrow, to do mail order condoms. So if people don't want to go out and buy them because they don't want to expose themselves to COVID, or maybe they're embarrassed, or whatever reason they don't want to go out and buy them, we'll mail you some for free, no questions asked. You just have to give us your contact information, which will be completely confidential. So I'll make sure to post that to our social media after this. And then also everybody pretty much, so PAR and We Are Family, which are represented here on this panel, all have free condoms too. So how can people access those through you right now?
So for People Against Rape, I would just recommend calling the hotline. Typically, or right now we are still working remotely, but we can always figure out a way to serve the community if it involves meeting up, a drop off. So yeah, I would just recommend calling our hotline.
Mm-hmm.
Cora, how about you?
And for We Are Family, so we have a thrift store called Closet Case Thrift that we operate from within, and people can come and pick up our condoms just in person. That's pretty much it. It's pretty easy. We do have some limitations for how many people can be in the store due to the COVID-19 pandemic, but you can walk into our stores and get as many condoms as you like.
Awesome. Fantastic. Cool. So there's lots of options out there. So speaking to Cora, we're going to move on and ask you a quick question. Some people actually might think that accessing contraception and birth control is not really an issue that affects LGBTQ individuals, but that is not true. We know that's not true. So can you explain, what should people know about that?
Okay, so as you said already, specifically, queer youth that we're talking about, and the populations that we serve, we know that that's way farther from what the actual truth is. Different types of people engage, everyone engages in sex. Some people don't, but as we, talk about reproductive health care, we make the assumption that most people do, of course. And accessing reproductive health care is something that queer people need to live healthier, more vibrant lives, as we know. And so queer youth, and especially when we think about the methods of protection that Bradley just used, they have a harder time accessing these barriers and these long-term birth control methods due to stigma and discrimination that they may experience when they go to different healthcare facilities. And so people should not, and I say people, but I'm talking about mainly like physicians and parents and everyone else, people should not assume what type of healthcare these people have based on their identities, but based on their behaviors. And so a lot of the time when people go to the doctor, they may have a physician that assumes that they may not be engaging in sex that they can end up pregnant from, or that they don't have certain risk factors based on their identity, but that is not true. They need to dive deeper into the behaviors and not just focus solely on someone's identity when they are approaching them about accessing reproductive health care. And so yeah, I think that question kind of answers itself. We need to diversify the ways in which we approach people to talk about their health, especially queer youth. And we need to make people feel more comfortable expressing the kind of their concerns about their healthcare when they come into the door, basically.
Right. So what you're saying is that really the burden right now is really on the medical community to ask better questions. And that may or may not be happening in certain settings. So, and we shouldn't make judgments just because someone says, I'm, gay or I'm a lesbian, that I don't need, birth control. Because there's other reasons people use birth control too.
I think the burden is on multiple different systems that come into play. Recently, I talked to somebody about how the education system plays into people not being able to readily access certain care, and that's with education and preparation for people to go into doctor's office and ask for what they need. When you don't have sex ed in schools, for example, how are you supposed to get information about your bodies to go out there and defend your body and access the care that you need for your body? And so there are multiple systems that come into play in someone, especially queer youth and queer people in general's ability to care for themselves or have someone else provide care for their bodies. So
Excellent
it's like yes, it's definitely like a multi-layered issue that we're experiencing, not just in the medical realm, but that's definitely where this plays out most of the time.
Excellent point about the education system. And that is kind of where it starts. I've always, that's my perspective, is that it always starts at home with the way parents are educating, and also in school, and how much teens are getting educated in school, so that they can be assertive and ask ask the right questions when they go to the doctor and things like that. So thank you so much for that. And Tanel, we're going to move and ask you some questions. So we often talk about birth control and contraception, and we make this assumption that, abstinence isn't a viable option when it is for many people. So Tanel, what would you tell any youth and young adults that are watching our discussion about abstinence?
So with a lot of the teens that I work with, they probably think I grill them too much. Abstinent, even if you think you're ready for sex, because sex, one night or moment of sex can change your life forever, whether it creates pregnancy or you get an STI. So I encourage young people or young adults, maybe even some older adults, to think about the reasons that you want to engage in sex. Like, is it to connect? Is it just because somebody's telling you to do this? Like really assess like how is this going to change my life if I choose to have sex with this partner of mine? And what do I want the outcome to be? And if it doesn't align with your values right now, like, and so if you have these values of, wanting to do certain things, and if sex is going to get in the way of that, then I would definitely encourage you to choose abstinence. It's totally okay to do, and nobody should make you, I mean, I say nobody should, I don't like to use should. People may try to shame you in that, but your decisions are your decisions, and it's definitely okay. Be in control of when you choose to have sex, and not when other people tell you to have sex. It's kind of maybe similar to anything else. Like if you like to, the type of clothes you like to wear, the way you like to wear your hair, you know, you can choose that. You can also choose when you are ready to have sex. And abstinence, even if you've already had sex, it's perfectly okay to say, I choose not to have sex with you at this moment. And you really don't owe anybody an explanation other than no, like, I just choose not to have sex with you. So don't feel like you have to explain yourself to anybody. And so those are some of the most important things that I would say when you're thinking about whether you want to be absent or not. Just ask yourself, why do I want to have sex? Like, that's a huge question, and most people don't really consider it. But definitely ask that question, especially, why do I want to have sex with this particular person? So that's also something that might be important.
Right. The reasons for that can vary depending on your situation and who you're with. So it's something important to look at. So, what are some reasons that youth and young adults, especially those who have, a uterus and ovaries, or might need contraception, even if they have decided that? And this is for the parents who might be watching. So, why might your young person still need contraception, even if they're being abstinent?
Are you asking me that question?
I can open it up to the whole group.
'Cause I need more information. I do, I'm a natural person, and I do have concerns about sometimes being put on hormones if it's not necessary, and then the long-term impact. So I know we were hoping to have an OBGYN
Mhm.
explain that. So I would not necessarily encourage it, but I'm not a medical doctor. But I just am curious about the long-term impact of being on hormone treatment, and how that impacts people who are choosing to wait to have children later in their lives, and all of that stuff. So
Mhm.
I don't have the answer to that.
Gotcha. Would anybody else want to jump in and dare to answer the question of why might someone who has chosen to be abstinent need or want to be on contraception?
I'm just gonna say we're all human, and we lead highly spontaneous and unpredictable lives at times, and so there may be a time, even though you declare yourself abstinent, that you may want to engage in sexual activity with somebody, and so you may want to be protected on another level. So you may want to have birth control. I see that as definitely a viable option. Also, another reason, like, even if you said you were abstinent, I'm still going to relate this to being a queer person. So being on long-term birth control, you may suffer from gender dysphoria, and so being on birth control long-term may help you mitigate some of those feelings of having a period and menstruating. So I think, yes, there are conversations to be had about the long-term effects, like Tanel said, but at the same time, I think we should engage youth more on what they feel like they need for their bodies and better serving them, because it's give or take. Some of these, there's pros and cons to being on these things, but the pros for a lot of people may be greater than the cons in the long run.
Yeah, and I think for me, for any parents who are watching, if you're young person, and we're going to get into this discussion a little bit more, but if your young person comes to you and wants to talk to you about getting some contraception, let's say a hormonal contraception, there could be a lot of reasons. Don't assume it's because they're sexually active and then get defensive and upset, right? I think that, and then because what happens then, the conversation doesn't go anywhere and nobody gets what they want out of that conversation, because there are lots of different reasons, like Cora said, that somebody might want to be on birth control. Maybe this young person has particularly heavy, painful periods, and we know that some of the hormonal methods can help control that and lessen that for them. So have an open mind, I guess, and don't assume that if your young person comes to you, they're sexually active. It could be for a lot of different reasons.
Say that it is very important to research the side effects for your body type. It's kind of like when I work with people who may be prescribed depressive medication. Every depressive medication is not appropriate for even ethnic minorities. So I just encourage young people, adults, everyone to research your body type, the type of treatment, what are the side effects, because from that, I am working with some young adults who are depressed, and they feel like the birth control has, kind of contributed to that. Now, again, I don't know, but I do know that it could be a side effect. So just be mindful of that. You might have to change birth controls. I would also say if you have like understand the methods, because if you typically struggle with taking a daily vitamin by mouth, is taking a pill going to be helpful, or do you need another method that you don't have to necessarily think to or remember to take every day? So there are various kinds. So do your research first before you just say, I'm going to get on birth control, and then allow somebody to put you on a birth control just because it's easiest for them to give it to you, or it's cheaper, or because maybe your insurance won't pay for it. Like, I just want everybody to be responsible about what you are putting in your bodies and recognize your own body type and the impact that this can have on your body type.
Yeah, I agree. I think do what you can to learn, and that nodrama.org website that I mentioned is really, really great for researching different types of birth control methods, and the Planned Parenthood website. And do your research and find out what you think might work best for you, and advocate for that when you go to the doctor. Because like Tanel said, they are medical professionals, and they may have other options and advice for you. But you should speak up and not just assume that they're putting, if they say, well, let's just put you on the pill, that's necessarily the right thing for you. If you speak up and advocate for yourself, then you can have a conversation with your doctor to make sure that they are actually putting you on the right thing, right? So a lot of it comes down to communicating clearly with your doctor and being educated about the different types of methods. All right, awesome. Would anybody else like to weigh in on that before we move on to another question?
I would just add to that, just to emphasize how important it is really to research that, because we normalize everything to fit one type of person in society. And when you talk about birth control methods, like, it's meant for one specific person. Like, for example, with Plan B, if you have a higher BMI, it's likely not going to work for you. But I mean, I remember growing up and always hearing this notion like Plan B is an option for everybody, and it's not. So just really remembering that we get caught up in one narrative, and that it's really up to us to do what's best for our bodies. And it really does take a lot of research.
Yes. And for those of you who don't know what BMI stands for, it's body mass index, and it's the ratio between your height and your weight. And so what Bradley's saying is that if you have a certain BMI, if you have higher BMIs, certain birth control methods might not work as well for you. And so you need to do some research on that, like some of the Plan Bs. Awesome. Okay, so here's a question, and I can just kind of throw this out to the whole panel. How can parents and caregivers, so think back when some of you guys are younger than me, right, on this panel. So you were more recent memory, a young person or a teen. And so think back to your experience on what talking to your parents and caregivers was like. Maybe you had positive experiences, maybe you didn't have such positive experiences. You don't have to share that. But think about what that was like, and how can parents and caregivers start this conversation with their teens?
I think it's important for parents and caregivers to approach the conversation without judgment or trying to push a specific agenda, whether that be abstinence only or whatever it is, but to come to it from a place of education and autonomy for the child, of being able to provide them with the information to make healthy decisions for themselves. I think, especially in the area that we live in, we all have these, values and these beliefs about sex and about birth control. And if we're putting all of those beliefs into our education, we don't have education. We have, creating robots in conformity. So I think if we are very intentional about our focus and our desire to educate so that they can make educated decisions for themselves, I think that would make a world of difference in talking about birth control.
So taking our personal values and beliefs out of it for a minute and just having a really open conversation.
Absolutely.
we've talked about in previous panel discussions the importance of parents talking about their values with their youth. And if you're doing that on a regular basis, they're hearing you and they're internalizing that. And so you don't necessarily have to approach this conversation, um, in that raw, well, in our house, we don't believe in sex before marriage, right? They already know that because they've heard you say it. So maybe just kind of approaching it in a more open way to start with. Would anybody else like to comment on how parents and caregivers can approach this?
I think I would like to add commentary. So following up what Brittany said, I think parents need to be more honest with themselves about what they can and cannot offer their own children. And we need to stop thinking about parenting as such an individualized like avenue. Like, you can do community parenting and understand that there are certain resources and knowledge you yourself may not be able to provide your child in your household. So if you know that talking about your body and stuff, yeah, we all hope that parents are able to do this, but we know that that's not true. And so if you feel that way and you know that about yourself and you know that you cannot have a beneficial conversation with your child, then it may be nice of you to have your child have access to other resources and other people and other programs where they can understand how to better research methods about their bodies or whatever they need in order to better advocate for themselves when they go to their physicians. And I think that's more than appropriate to say. Because we hope that
Absolutely.
parents have a lot of information, but honestly,
Yeah.
life is wild and you may not have the knowledge yourself, and a lot of us have to pretend that we know stuff that we don't, which I think is more detrimental in the long run than just saying, like, I don't really know how to help you.
Right.
And
Sometimes fake it till you make it's not the best approach, depending on the situation. I like what you said about that, Cora, because parents, if you're uncomfortable and you have anxiety about this because your knowledge base might not be, you're concerned that you may not know all that needs to be known, use what you have available in your community and and use Empower, use People Against Rape, use We Are Family, use DHEC and Palmetto Community Care and all these organizations to help you with that. Don't feel so burdened. Reach out for help, I think is what you're saying, Cora. Like, if you don't know, if you're not an expert in something, you don't have to be, but go out and maybe find somebody in your community who can help you with that.
Yeah. And even saying that, that's a big step for a lot of people, because most people do not do that. I just want to say most people do not do that. It is very hard for a lot of us to claim ignorance when we are ignorant about something and then get on a path to greater understanding. A lot of people are just going to wing it. But
right. Like I said, don't always fake it till you make it. May not be appropriate. Anybody else?
I would just add, like, it's an exploration. Like, it's gonna be, I feel like I constantly learn new things about birth control methods all the time. And, like Cora basically just said, like, it's okay to not know and to learn it later in life. I enjoy having conversations about birth control methods and contraceptive with my friends now. Like, it's never going to be something that we shouldn't talk about.
Great.
I would encourage parents, if you are wanting to have a conversation with your teen, just ask them what they may already know, just to see what they've taken in, where did they get the information. I learned a lot by reading, but my initial exposure to sex was at a very young age, snuck and read my mom's romance novels. And so I was like, ooh, I had this ideal about this, to be rescued and, all it hasn't happened. So no, I'm just kidding. So I learned about sex like that. But my mom was very open to talk to us about sex. But she put the fear of God in terms of, you better not come home pregnant. And then when I became, I think around 15 or 16 is when someone told her, your daughter is very shapely. You might want to get her on birth control. And that's how I ended up on birth control. In my mind, I did not know that. I thought it was because I was having heavy periods. And this is something that, I was told, but she later told me, because, everybody. So I don't think I was ready, because I knew I didn't want to have sex at that time. So I think if we would have had a more in-depth conversation, she probably would have known that I wasn't gonna have sex, and I probably wouldn't have had to get on birth control so early. But so that was my first experience with birth control and sex.
So along these lines, then, so we've talked about how parents can start the conversation. Maybe parents are afraid to start the conversation, so maybe teens might want to think about starting the conversation. So do you guys have any advice for teens who might be wanting to start that conversation? How do they approach their caregiver or their parent?
I would say it's sex. If you know in your household, in your culture, in your religion practices that you're going to be, shamed or criticized, or I think ultimately the most important thing is finding somebody safe and responsible to talk to. And if that is not your parents, that is okay. I do want to caution you about, I think your friends who are your age may have information, but they may be learning the same way you are. So try to find a responsible adult or community service, or using resources to get the information. But don't feel like you have to talk to your parents if you already feel like it's going to bring about more shame. And I'm always trying to stop people from experiencing shame, because it's one of the worst feelings that people experience, and it's very hard to move past. So
Right. We want to facilitate conversations between young people and trusted adults. So, if you're afraid to talk to a parent or a caregiver for a particular reason, look around you, and is there another family member, a community person that you're particularly close to or that you can trust, and maybe reach out to them to talk to them about how to approach it. Anything else? Anybody else want to weigh in on that? All right. So then we'll just move right along. And we're going to have a little fun. We did this in one of our other panels, and I think it went really well. It was a lot of fun to do. And so we are going to do another agree or disagree activity. And I'm going to read some statements. And then you're going to tell me if you agree or disagree. And then we're going to talk about why you feel that way. You guys ready? Everybody has their signs, their agree and their disagree signs. All right. So the first one, if a person is carrying condoms or taking birth control, then they must be promiscuous. Agree or disagree? Hold your signs up for me. Tanel's disagree, right? Disagree. Okay, Bradley, everybody's disagree except Bradley is agree. So Bradley, tell us why you agree.
I'm agreeing to give the other side of it, because if someone's doing that, then they must be engaging in sex, even though, like, what is promiscuity? I don't know. Anyway, it could imply that they're engaging in risky behavior.
Okay. So that must mean that they are just throwing it out there, right? Okay, so Cora, why do you disagree with that statement?
Okay, so I think we all, in our mutually shared culture, we understand the negative connotations of calling someone promiscuous, especially that is a term regarded for women, more feminine people. And so that's why I disagree, because I understand the shame and the stigma that people use, especially if you're a young person out here having sex.
Very good. Anybody else want to weigh in on that? Right. So what that goes to is stigma, right? Why are we stigmatizing people for making decisions? We shouldn't be doing that. And also we can look at that if somebody is carrying condoms and or taking birth control, that they're doing what they need to do to take care of themselves.
Mm-hmm.
And they're advocating for their own bodies, and they're being safe, and they're doing, their part to for public health, right? It's kind of like this whole debate that we have right now with mask wearing. Whether or not you should be wearing a mask, and you should be wearing a mask. You should also be using condoms and taking birth control. All right, so you guys want to move on to the next one?
Mm-hmm.
All right. All right, agree or disagree? It's hard to talk about protection or birth control with a partner. So now I can't read yours. Bradley's disagreeing again. She's disagreeable today. What does
No,
yours say, Tanel?
Hard. It's not hard. I'm disagreeing with the fact.
Okay. All right. So Tanel, do you want to take that then? Why do you disagree?
I can speak personally is again because I guess for me it's like choosing to eat something that I don't want to eat. Like I know I'm not going to eat it just because it makes you feel comfortable. So I mean, I'm just an open person, so I can have that conversation. So I might not be the barometer of who to go by, but I don't find it very difficult. It's because I recognize my body, my soul is where my house lives. This is my house. I got to take care of it. So I'll do whatever I can to take care of it.
Yeah. How about, I would say, Brittany, you agreed with that statement that it's difficult. So
Yeah.
tell us why you agree.
I think it's difficult just because of our lack of communication as a society when it comes to sex and having those important conversations. So I think if, coming into a situation where you're wanting to say, hey, before we get started, let's talk about this. I think a lot of people get very weary and get very scared about that. And also, what if the person doesn't want to use a condom? Are they going to not have sex with me now? Or are they going to think differently of me? So I think there's a lot that plays into that conversation and why people choose not to have it.
Yeah, it can be really awkward and uncomfortable. The one thing I would say is that if it's awkward and uncomfortable to have that conversation, then maybe you should step back and think about whether or not you should be engaging in that activity with that person, because you should be engaging and I don't want to place too much judgment on who people choose to engage in sex with and who they don't, but you should be comfortable enough to assert your opinion on whether, and assert, using contraception or condoms with a partner. And if you're not comfortable speaking up for yourself, then maybe you're not in a place to be engaging in that behavior with somebody else. Does that make sense? I think that makes sense.
I think that makes sense. At the same time, that's a goal, I think, because based off, I agreed like Brittany did, and I did because most of us have to wait until adulthood to gain the skill set to advocate for ourselves with the partner or even know what should be said about contraception with the partner. And so remembering me a few years ago when I was a teen and stuff, like I just didn't have the tool set. Like I knew certain things that I wanted, but the word choice and the skills to say that and with determination and force, I had to grow into that as well, because I was not given that tool set until
right. This goes back to that education stuff we were talking about earlier, Cora. If we are able, if that were part of the toolkit that we were providing young people in education, they would have a lot easier of a time doing it. I think. So that's something that any caregivers or parents or trusted adults who are watching can think about too, is learning how to help a teen role play and practice that assertive communication. I think is a really helpful thing.
And I think also being able to role play what that person might say and how you would, because if a person doesn't want to and they're trying to convince you, they're going to probably use all this wonderful, oh, but I love you and I'm good. Don't you trust that I'm taking care of myself? I'm not going to give you anything. So all these things are going to be, I agree. Role playing takes and practice with somebody, a friend or somebody, again, that you feel safe with. And, that's important.
Yeah. Cool. Good. All right, so the next one, agree or disagree, using condoms ruins sex. Okay, we got a disagree, and two who aren't answering. You don't have to answer if you don't want to.
I didn't know if I was supposed to be devil's advocate.
Okay. I'll let you play devil's advocate, Tanel. Are you comfortable with that? No. Okay. So everybody disagrees. That's fine. Who wants to tell me why they disagree?
Well, I think there are different types of condoms with different types of textures and different types of flavor and heat sensitives, all these new things that's being created. So there's a variety. I would just say that.
There's lots of ways around the barriers.
Yeah.
I disagreed because it allows you to have more sex with more people if that's what you want. It's a way to obviously stay protected, to prevent pregnancy and STDs. Lubricants can make it just as enjoyable. And I think all of us disagreed because it's such a stigma and so many people say that, and we need to stop doing that.
Agreed.
Agreed.
I agree to your disagree. Also, I think too that if you know how to communicate about it and you know how to advocate, this goes back to us talking about teaching young people how to like really communicate what they want and don't want. And if they know how to communicate what they want, and if that is using condoms, it's not going to ruin the moment. You hear that a lot too. It's going to ruin the mood. Well, it's not going to ruin the mood if you know how to communicate about it. Great. Anybody else want to add anything else in?
I can see why people say that using condoms could not enhance pleasure, especially if they don't have the correct condom size or put it on the wrong way. At the same time, and then there are people who actively do not want to use condoms at all. At the same time, condoms do make for safer sex, like Bradley said. And then also, I don't know people's pleasure levels, so I can't say that using condoms, that's the same or the greatest sex or anything, but I say it is safer.
Mm-hmm.
Yeah, we hope that would enhance the enjoyment of it, right? If you feel like you're being careful and safe. Right. Good. Okay. Let's see. We already talked about that one, so I'm going to skip that one. But okay, here's one. If you have, agree or disagree, if you have already had an unplanned pregnancy, it's too late to worry about being abstinent or even using birth control. Oh, we have a agree. We have a dissent among the group. Okay, so let's start with you, Brittany. Tell us why.
Purely for the educational purpose.
Got it.
But
this is not your personal opinion.
Not my personal opinion. Even if you've already had an unplanned pregnancy, even if you've had 3 children, or whatever the case is, these are all choices that you can make for yourself. It's never too late to make a different choice. So if you have 3 children and you are now wanting to be abstinent, and you don't want to, and you want to use birth, you wouldn't need to if you're abstinent. But if you weren't abstinent and you decided you didn't want to have any more kids, then use your birth control. It's not something that if you didn't do it before that you can't come back to again, because it's absolutely up to you and what you decide for your life. And life comes with a lot of, curveballs and a lot of changes, and it's okay to change how you continue through life with different information and different experiences.
Mm-hmm. Great. Anybody else want to speak up?
I would just say if you had 1 kid, it doesn't mean you want another. So don't feel like you have to do that. It's okay if you want 1. You don't have to have 4. And if you have a partner or partners that are pressuring you because I know this is a thing, that if they're pressuring you to continue bearing children or having children, that's your decision, and you should be able and have the autonomy to make that choice. And if you don't, then you may be in a situation of manipulation.
Mm-hmm.
Mm-hmm. Anyone else want to comment? I think if we're, maybe sometimes young people or teens might have this, or they may hear this from like their friends or their community, that like, if you've already started engaging in sex, then you can't, that's the decision you've made and now you are sexually active. Well, that's not really, That's not really true. I mean, you're sexually active if you want to be sexually active, and you're sexually active when you're sexually active, and you're not sexually active when you're not sexually active. So if you've had sex and you're like, I didn't have the greatest experience, or maybe you had a wonderful experience, but then you're like, I don't really want to do this right now because I have these goals and dreams, and this is just not something I want to get in the way of that, you can always choose not to do it. Just don't let, any sort of stigma about that affect your decisions in the future. You know what I'm saying?
I think when I hear people say sexually active, maybe some young people take that to mean once you start, you have to keep going. I
Right.
don't really agree with the phrase sexually active. I don't even, I mean, I know we say that, but it doesn't mean like you have to be turned on. I maybe just say I'm choosing, or you don't have to tell anybody. But here's the thing, you don't even have to, the only people who need to really understand or know that you're sexually having sex are yourself and the person that you choose to have sex with. So don't feel like you have to even be out here discussing with anybody what you're doing with other people, especially if they are making you feel bad about it. Just don't talk about it with anybody. And I think that's, something to walk away with. I don't know if you have to say you're sexually active if you're having sex once. Again, I think that phrase can be misleading for some people, or kind of maybe put out there again that whole active means you're out there, and it just,
Right.
I don't necessarily like those words. I don't know what they mean, and I don't even know how we got to start using them as a culture. But
Right. The terminology should be changed. It's not like a light switch that you turn on and leave on, Like, and that's kind of what that sounds like when you say that. So I agree. We should probably think about a different way of even talking about it. Cool. Does anybody else have anything to add to the agree or disagree game? Or to that particular one?
I agree that everybody has done an awesome job.
Yes, everybody on the panel has done fabulous today, but always. But especially our control person, Tanel Jones, who made sure that we didn't have any technical difficulties for probably the first time ever. So thank you. Thank you, Tanel.
Yeah.
All right, well, that pretty much wraps up our discussion for today. We will be back with more live panels in the future. And we hope you've learned a lot from today's panel. And thank you everybody for being on today. You guys did an amazing job, as Tanel said. And for those of you who are watching, keep checking back on our social media, Empower 2014 for our Facebook, Twitter, and Instagram. And please check our YouTube as well if you for other videos that we've done. And we'll be back soon. If you guys have any suggestions for panels that you want to see us do, please email me at Borkman, which is BORKMAN @musc.edu, and let me know what your thoughts are. All right, so that'll be it. Everybody have a wonderful weekend. Happy Friday, and we'll see you all next time.